Okay, so let's start. Good afternoon, everyone. So, as we know that we have chosen diabetes as our topic today to explain it very simple to you. So, we have been hearing about diabetes since very long time. Here and there, somebody has diabetes. I have, or your mom or dad, somebody has diabetes, right? Now, why we need to know in detail about diabetes? Why is it so important to know? Is that the statistics of diabetes has been increasing a lot all these years. So according to the statistics, okay, in 2021 there's 531 million people suffering from diabetes. That is 1 in 10 people all over the world is suffering from diabetes. Now by 2030 it's going to increase to 643 million. So there is a drastic increase in these years, and by 2045 it's going to increase till, as per prediction, it is going to increase till 783 million. If you take the Middle East, again 1 in 6 are suffering from diabetes. So again, there is 73 million people suffering from diabetes in Middle East and North Africa, and by 2030 they say 95 million will be suffering from diabetes. So according to our lifestyle, our sedentary lifestyle, our diet, junk foods, all this also has been a part of increase in the case of diabetes. So it's very important for us to understand what exactly is diabetes. What are the types of diabetes, what are the symptoms, what are the risk factors, and for the next session we'll be discussing in detail about all other things. So let's go into a simple explanation. Okay, what is diabetes? Now we know diabetes is a metabolic disorder. It's a metabolic disease that can cause high blood sugar. So the moment you hear diabetes, we all know that it is a high blood sugar level that is in the blood. Okay, now how does the blood sugar level increases in your blood? Means when you have any meal, okay, the carbohydrates or the any food, it's broken down into carbohydrates, which is a part of sugar. So the sugar will be in your bloodstream. Okay, now it's in the bloodstream. Now we know insulin has a role in this. So pancreas is producing insulin. So this insulin acts as a key to open the cells and transport this sugar into the cells. So the insulin opens the cell and the sugar is transmitted from the bloodstream to the cells. And in the cells, this is stored as sugar, and it's utilized as energy for the body functions, for your energy level, for your activity, everything. Okay, now we need insulin for the transmission. Okay, we are taking this from the bloodstream to the cells. This insulin, either what happens, it is not produced, or it is not enough produced, or it is less in the bloodstream, or the insulin, the cells are damaged, so there is no insulin produced. Okay. Now sometime what happens, the cells does not respond to the insulin at all. So that is another reason for less insulin or no insulin, or the blood sugar levels which is going high, is because of these factors. So now we understand what is diabetes. So when it is not transmitted, it is still there in the bloodstream, which causes high blood sugar. Now there is a lot of types of diabetes. One is type 1 diabetes, second is type 2, then there is pre-diabetes and gestational diabetes, and there is few more kinds of diabetes which we will not discuss here because it's quite complicated. Okay, now type 1 diabetes is not very common. It's only 5 to 10% among people. It's most commonly seen in children, teenagers and young adults. Okay, and this type 1 diabetes is an autoimmune condition where the cells that is producing pancreas has been destroyed. So there is no insulin produced. Hence, the blood sugar level stays as it is and goes high. Type 2 diabetes is the most common seen diabetes. It's seen 90 to 95% is type 2 diabetes. Here, either there is less insulin produced, or the cells do not respond to the insulin. So this factors leads to type 2 diabetes. So you see diabetes, type 2 diabetes in adults and old age. It can, usually olden days it was like 40 years and above you see type 2 diabetes, but things are changing now. It was in 30s, now it's even coming to 20s. So that's the reason we have to be careful about it. Okay, now I'll explain about pre-diabetes. Pre-diabetes is a state which is before type 2 diabetes. So if you diagnose it early, you get a state of pre-diabetes. You understand that you are at risk and you have to be careful about it. Pre-diabetes means the sugar levels are high, but not as high that we state officially that you are type 2 diabetic. So when you know you're pre-diabetic, it's a good thing. The good news is that you can be careful with your lifestyle and your diet, which can actually prevent from going into a type 2 diabetic person. But if you're pre-diabetic, you are at high risk of developing into type 2 diabetes. Then another one is gestation diabetes. As we all have heard about it, gestational diabetes is a diabetes which is diagnosed during the time of pregnancy. So when you're pregnant, your gynecologist might do a checkup, and in that you can know that if you're diabetic or not. Usually by the time of 24 to 28 weeks, the doctor used to do a test, fasting sugar and a GTT, so that they check your blood sugar levels and get to know. Usually there is no much symptoms for type 2 diabetes and gestation diabetes. So now we know that there is what is diabetes, what are the types of diabetes. You need to know the risk factors to understand, are you at risk, or you have to be careful. You understand when should you do your checkups. For type 1 diabetes, the risk factors are: you have a strong family history of type 1 diabetes, any injury to pancreas, maybe any accident, maybe tumor, infections, or even surgeries can lead to a type 2 diabetes. Presence of any autoantibodies means destruction of the cells. Any physical stress, exposure to any illness which is caused by viruses, that can lead to type 1 diabetes. Here you have to understand that the body weight or the obesity is not a factor for type 1 diabetes. Now for type 2 diabetes, having pre-diabetes is a risk factor. Gestation diabetes is a risk factor. 45 years and older is a risk factor. Having a family history, like your parents or aunts or sisters, siblings, anyone having diabetes is a risk factor again. Physically inactive means you have a sedentary lifestyle and you're not having exercise for more than 3 days per week can lead to type 2 diabetes later on in your life. Having non-alcoholic fatty liver disease can lead to type 2 diabetes, and Asians are more prone to get type 2 diabetes. African American, Hispanic, Native Americans, Asian Americans are more prone to get type 2 diabetes. High blood pressure, high cholesterol, smoking, alcoholism, any mental disease like schizophrenia, psychotic, bipolar, those patients are more riskier to develop type 2 diabetes. And even disturbed sleep or reduced sleep can lead to type 2 diabetes. And if you discuss about the risk factors of gestational diabetes, family history is a risk factor. Excessive weight gain or obesity prior to pregnancy can lead to type 2 diabetes. And be like 25 year and older, can not often can lead to type 2 diabetes. So these are the risk factors which can lead to diabetes. Okay, so I hope this is clear until now. Okay, so regarding the symptoms, basically most of the time diabetes is not diagnosed. The reason behind that is it's mostly asymptomatic. You don't have, or you don't recognize or realize that I have a symptom like this, because it's not very in the early stages. It is not really, you don't feel it much. That's why most of the time type 2 diabetes is not diagnosed. It is not diagnosed at all. For 3, 4, 5 years it's not diagnosed. So generally they can be, you feel like you wanted to urinate frequently, you feel very thirsty, dry mouth, dry skin, you feel more hungry, there is unexplained weight loss, like you're not doing any exercise, you're eating really well, but still there can be a chance of weight loss, feeling very tired. That is the most common symptom that we see, that they complains of feeling very much tired, mouth is too dry, I feel like drinking a lot of water, and I go to the toilet all night, I don't sleep well. These are the most common symptoms that we hear day to day. And later, when we know that it's been so long it's not diagnosed and elderly, there can be frequent infections, frequent urine infection, fungal infections. There can be soreness in your feet, and it is not healing really fast. These are the most common symptoms that we see. If you specifically look into type 1 diabetes, it develops in weeks to months. It doesn't take long. It develops in weeks to months. And most commonly, all the symptoms can be there. But along with that, the patient might complain of abdomen pain, nausea and vomiting, urinary tract infection, yeast infection, like that. And type 2 diabetes, again, as I mentioned, almost all the time, patient don't have any complaints. They don't really feel the symptoms. It is slowly developed. So it's not, so you develop pre-diabetes first, and then it goes into the diabetic stage. Okay, so next is gestational diabetes. As always, I have mentioned that, the gestational diabetes is always tested by the doctor by between 24 to 28 weeks, and then that's found out. Now, those are the symptoms that we discuss now. So I'll just give you a small example. Fasting should be less than 100. And when do you say you're pre-diabetic? Like, when do you say that, yes, there is an alarm and you have to be careful? That is when it is between 100 to 125. And when it is more than 126, yes, that's when we say you are type 2 diabetic. So this is a very simple explanation. I hope you all have understood. Any questions, any doubts, please feel free to ask. Further, like treatment, investigation, everything will be discussed in the part 2. So we'll not jump into it right now, but anything else?